everybody. Let's talk about hernias, okay? There are many different types, okay? Many different types of hernias, but before we get into the types, what is a hernia? Okay, what is it? So it's a protrusion, okay? A protrusion of viscous through an abdominal opening or a weakened area, okay? Abdominal opening or a weakened area, okay? It's a protrusion. It's protruding through, all right? It may be reductible or irreductible, all right? But the different types is femoral, okay? And you can guess where that is, right? Femoral hernia, inguinal hernia, okay? You have an umbilical hernia, and you have a ventral hernia, okay? You can have an incisional hernia, all right? Hiatal hernia, okay? There's so many different types, okay? So many different types of hernias, but hernias in general, the assessment, how are you going to assess this? You're going to palpate, okay? Palpate. What you're going to feel like a sac, okay? A sac, and in the sac, the contents contain will feel soft and nodular, all right? Smooth, okay? Smooth and fluctuant, okay? That's what it should feel like. Never attempt to push it back in place. So we are going to palpate, but just touch it, okay? Don't try to push it back in or try to correct it or in any way, okay? Don't do that, all right? Signs and symptoms depend on the location that it is, but it will be a protruding mass. That's what you need to remember, all right? If complications, there will be some vomiting or abdominal distension, okay? Diagnostic testing for this is palpating the mass, again, palpating, and then imaging, okay? Imaging as well. Medical management, if there's no discomfort or no life threat, then they're going to leave it alone, okay? If it's not causing any problems, they're going to leave it where it's at, okay? But they do need to seek medical attention if they develop the abdominal pain, if they have distension, if they have any change in any bowel habits, okay? If they're constipated or any of that, change in bowel habits, they do need to report that. Change in temperature, nausea, vomiting, all right? Then they need to seek medical attention for possible further care, all right? Manual reduction is also a form of medical management, but not by you, okay? And then an abdominal binder, all right? They can surgically repair it, okay? And that's called a herniorrhaphy, okay? Herniorrhaphy, that's a weird word. All right, post-op, your nursing interventions of post-op would consider to monitor for urinary retention, monitor for infection, enema. Okay, you guys know post-op, all right? Avoid heavy lifting and straining and stuff for at least 6 weeks, okay? Teaching, avoid prolonged standing, all right? Avoid prolonged standing, lifting, straining, all right? That can also make it protrude further. Support the area when coughing, all right? Support the area, especially if it's in the abdomen. Okay, with maybe a binder. Dietary recommendations. Wait 1.5 hours after meals to lie down. Okay, minimize caffeine and spicy food intake. Sleep with the head of the bed elevated. Okay, semi to high Fowlers. All right, and try not to gain excess weight. This can also make it worse. Okay, so now hiatal hernias specifically. This is a protrusion of the stomach, okay, through a hiatus in the diaphragm, okay, which weakens the diaphragm. All right, that's a hiatal hernia. It's higher up, okay, hiatal, high up, okay, by the stomach and the diaphragm. All right, this is more common in older adults, okay. They will complain of pyrosis after overeating, right? Usually corrected with surgery, as I mentioned, like all the other hernias. And then your nursing care is similar as for gastric or thoracic surgery. It's going to be the same, pretty much the same, because of the area that it's in. Okay, so again, hiatal hernia is high up, protrusion of the stomach. Okay, protrusion of the stomach through a hiatus in the diaphragm. All right, which weakens your diaphragm. Just recapping. All right, and then that complaint of pyrosis after overeating and stuff, you're going to rule out GERD first, right? You're going to definitely try to rule out GERD, because that's one of your signs and symptoms for GERD too. You're going to try to rule out all of these other things. But what's going to differentiate the two you should be able to palpate this mass, okay? And there's your hiatal hernia or your hernias.